Every year, thousands of Nigerian babies are born with birth defects, some mild, some life-threatening. But what causes these birth defects? Can they be prevented? And how do we support the affected families? Now, stay glued to the end of this video to understand what birth defects are and how to prevent them in your born babies with simple diet and lifestyle changes. Birth defects are structural or functional abnormalities present at birth that can affect how a baby's body looks, how it walks, or both of them. Now, the common birth defects are categorized into physical birth defects, which includes the cleft lip or club foot, and we have the internal birth defects like heart defects and neural tube defects. Now let's look at what causes these birth defects. While some of these birth defects can happen by chance, the other ones are linked to factors like genetic inherited conditions from the parents. It can cause these birth defects. Then we have factors like nutritional deficiencies, which is as a result of lack of folic acid, which increases the risk of neural tube defects like spina bifida. So when a woman does not take enough folic acid before pregnancy or during pregnancy, it increases the risk of developing these nutritional deficiencies that can lead to neural tube defects. Now, another factor that can cause it is infections during pregnancy. Infections like rubella, syphilis, and the Zika virus, they can cause this congenital defect in babies. Now, let's look at exposure to harmful substances. This is another factor that can cause it when a woman is always drinking excess alcohol or engaging in tobacco smoking and certain medications that can affect the fetal development of the baby. These are factors that can cause neural tube defect. Then finally, for the women that do not engage in the proper antenatal care, they have limited access to quality prenatal care. This can also increase your risk of having a baby with neural tube defect. Now, in Nigeria, some of the most common birth defects include neural tube defect, which is the spina bifida, anencephaly, which is linked to folic acid deficiency. Then we have the cleft lip and cleft palate. This can affect feeding, speech, and appearance of a baby. Then we have congenital heart defects. Some babies need surgery to be able to survive this heart defect. Then we have the club foot, which affects how a baby walks, but it can actually be treated early if it's diagnosed early. Now, the final one is Down syndrome. It's a genetic condition that affects the total development of the baby. While not all the birth defects can be prevented, some steps can be taken to reduce the risk of developing these defects. Number one, take folic acid supplements as a woman within the childbearing age. You can start before pregnancy for best results. Then attend regular antenatal checkups. Do not miss your antenatal care because early detection can save the life of your unborn baby. Avoid harmful substances. Please, as a woman in a childbearing age, say no to alcohol, smoking, and certain hard drugs. Then get vaccinated against rubella and tetanus. It will help to prevent infections that can cause this birth defect in your unborn child. Another thing you need to do is if you have diabetes and high blood pressure, please manage these chronic conditions with your diet and your lifestyle changes. A birth defect diagnosis can feel very overwhelming, but remember, the right support is available through surgeries, therapy, and early treatment. It can help to improve the outcome of the babies. Now, another thing is support groups and counseling. It can help the parents of the babies with the defects to cope better. Then community awareness. By reducing the stigma and increasing acceptance, it is very crucial to support families that have babies with neural tube defects. Every child deserves a healthy start in life. So by spreading awareness and taking preventive steps, we can reduce these birth defects in Nigeria. Now, if you found this video very helpful, kindly like, share, and subscribe. Let's keep this conversation going in the comment section. What are your biggest concerns about pregnancy health? Please let us know in the comments.